registered nurse and a certified diabetes educator at South Miami Hospital. And my job is to educate the patients, staff, and nursing students about about diabetes.
Okay, right now we're going to ask you a couple of questions about type 2 diabetes. And I want you to start by telling you, for you to tell us, what is the definition of type 2 diabetes?
Type 2 diabetes is a metabolic disorder where the person is not able to regulate their blood sugar properly. Type 2 diabetes specifically, well, that's diabetes, but type 2 diabetes specifically is caused by insulin resistance or an deficiency, an absolute deficiency in insulin. Usually it's insulin resistance initially, and a person can have insulin resistance up to about 10 years before they're even diagnosed with type 2 diabetes.
What are some of the causes of type 2 diabetes?
Causes, I would say, rather than causes, I'd say maybe risk factors for type 2 diabetes. If you have it in your family, there's a high risk of having type 2 diabetes. If you're overweight, it increases insulin resistance, and that causes type 2 diabetes. If you had gestational diabetes, which meant you had diabetes while you were pregnant, you were high risk to develop type 2 diabetes. If usually it was considered over 40, being that it's adult onset, you're a higher risk for type 2 diabetes, but also type 2 diabetes happens in children as well. If you've been on a lot of steroids, if you've had cancer, respiratory problems, steroids make your sugar higher. Sometimes the sugars don't return to normal. Certain ethnic groups have a higher risk of having type 2 diabetes. African Americans, Hispanics, American Indians are some of the highest ethnic groups that have type 2 diabetes. Those are some of them.
What are some of the complications of having uncontrolled type 2 diabetes?
The significance of having diabetes is that hyperglycemia, high blood sugar, damages blood vessels and nerves. It causes swelling, inflammation, increased arteriosclerosis. It causes damage to the whole cardiovascular system. So that's where the complications come from. So a person with type 2 diabetes, type 1 diabetes, it doesn't matter because high blood sugar is high blood sugar. It can cause damage to organs like your kidneys, increased risk of having a heart attack, increased risk of having retinopathy, circulatory problems in the feet, many things for uncontrolled diabetes. And some people have diabetes for many years and they don't have any problems at all. And some people have diabetes for like 2 or 3, and they're actually diagnosed. Some of the people at the time of diagnosis, they're actually in with a complication already. So you never know who's going to have complications, but certainly long term is the cardiovascular disease and the neuropathies.
What are some of the preventive measures a diabetic patient should take in order to prevent foot ulcers?
Foot ulcers?
Yeah.
Good blood sugar control is number 1. Wearing good fitting shoes so that they don't develop skin breakdown. Not smoking. Smoking is going to complicate the circulatory problems. Going to see a podiatrist on a regular basis. Always covering their feet. Don't walk around barefooted. And being very careful doing pedicures that they don't cut any corns or cut the nails too short, because that can, anytime you break the skin, you leave it open to skin breakdown.
Do you think diabetes type 2 is becoming an epidemic in children?
Yes, definitely. The lifestyle changes that kids have nowadays, not exercising as much as they used to, sitting in front of the computers, eating all the junk food, they're overweight, and they're developing type 2 diabetes. And once you're diabetic, it doesn't go away. So these children are going to have it a long time. It is epidemic.
Okay, thank you very much for your time.
You're welcome. Good luck.
Thank you. Thank you.
Hi, my name is Michael Salanero. I'm a registered nurse. I'm the assistant nurse manager of the outpatient wound center at South Miami Hospital. Here in the wound center, we treat all sorts of different patients, from diabetic feet to pressure ulcers and everything in between. You guys have any questions?
Can you talk to us a little bit about the patients that usually come here due to diabetes and they have ulcers on their feet?
The typical ulcer that a diabetic will present with is a diabetic foot ulcer. Diabetic foot ulcers are caused by pressure and neuropathy. Neuropathy is decreased sensation. It usually is not in the numb foot, or what we would think as some decreased sensation, but decreased protective reflexes in the foot that stop a patient from knowing when their foot breaks down or the skin breaks down, and then repetitive pressure onto that ulcer creates, deep, complicated ulcers.
What treatments do you use for these patients?
Here in the wound center, we have hyperbaric medicine. We have all sorts of different topical dressings. We usually do frequent debridement. We also use healing sandals, total contact casting, and different types of skin grafts from cultured skin products, typically.
What do you usually teach the patients to wear shoes, how to prevent the ulcers?
Prevention comes through just diabetic foot management, noting that if there is neuropathy, that the foot needs to be evaluated on a daily basis with a mirror, and treat any breakdown while it's in the early stages, not in the late stages.
How long does it take for an ulcer to heal in a diabetic patient?
It can take anywhere from a couple weeks to never. Really, if we don't see a marked decrease in the size within the first 6 weeks, so if we don't see a 50% area reduction in the first 6 weeks, the ulcer is probably going to last for years and years and end up in an amputation.
Okay, thank you so much.
Oh, no problem.
Thank you.
Thank you very much.